Good day, friends of Buzzy. Well, goodness gracious, we're about a week past Christmas and positive tests are popping up all over, and I'm getting bombarded with COVID questions. In addition to answering all of those questions for you, I am going to address an article that came out yesterday in JAMA, which found that in contrast to the Pew research on who is willing to get a coronavirus vaccine, the Pew research found it was going up, but the JAMA article found that since April, the actual percentage of people willing to be vaccinated is going down. So I want to take a little bit of time to address some of the biggest barriers that people said in this study were causing them to be skeptical about getting the vaccine. But then we're going to go past that to previous research and how it can impact what we're doing now. If you have not yet done it, and if you have tested positive for COVID, we have another video that talks about what to do that is solidly research-based, that is largely research-based, and that is probably a good idea, but it's not the kind of thing we're going to get a research answer on. That is a different video. Go ahead and check it out. But in the meantime, I would like to take it away with this little PowerPoint that I made. All right, so it's our friend, the SARS-CoV-2 virus, and it has started to have mutations that make it behave a little differently. So it's important that we talk about the herd immunity breakdown and what we're learning about who is going to take the vaccine. All right, so this is the population of America, 330 million, moved into 100 people. 60% is what we used to say was needed for herd immunity. Now we're saying maybe it's 80. So what the Pew research found was that 20% said they wouldn't vaccinate, 17% said they probably wouldn't, 3% are going to get the vaccine, but it actually doesn't work for them because it's only 95% effective, and 15% will only get one injection, but it's not going to be enough. So let's talk about what the research found were these reasons behind not getting vaccinated. So the Pew research said that 37% said they were unlikely. In April, 74% said that they were somewhat or very likely to get the vaccine. By December, it's down to 56%. So let me address some of the concerns people had in this article by Zlagi et al. And talk about why you really shouldn't be that worried about it. First of all, we see someone at Lurie Children's getting her COVID vaccine with a Buzzy. Thank you for sharing that picture. She does not fit any of the demographics that are having more issues, except that she is female. So it turns out that the somewhat or very likely to get a vaccine was lower among women, 51% versus 62% in men. Black people are less willing to get the vaccine than white people. This is clearly due to Tuskegee, to Henrietta Lay, to many different issues in the past where the healthcare system has let Black people down. Even as recently as the day before Christmas, one of my colleagues, Susan Moore, who is in the Physician Mom group, who was posting videos of herself in an Indiana University hospital, unable to get good care because she was Black, trying to get good care. All of us at Physician Mom group were trying to call people. Many people were going to administration. Nonetheless, as hopefully you've seen by now on the news, she passed away, and it was unquestionably related to some issues of systemic racism that unquestionably make Blacks much less comfortable trusting the healthcare system. We got to do more about that. Younger people, 18 to 49 years, were less likely to get vaccinated than older people who were over the age of 65. That was 51% versus 69%, and we'll talk more about that. And people without a bachelor's degree versus having a bachelor's degree were less likely to be willing to get vaccinated. All right, so let's dive down a smidge into some of the questions that are are causing people not that people are citing for reasons not to get vaccinated. Okay, so first of all, efficacy. Unquestionably, the Moderna and the Pfizer vaccines have solid data for efficacy. This was done beautifully. This is a prospective blinded trial. If any of you know people who were in the trials who didn't know whether they got the vaccine or not, or had to go get antibody tests on the sly, you know that it was done well. It was a randomized trial. It was exactly the same for both groups, and they didn't know whether they got the vaccine or the placebo. It was blinded. So efficacy we're solid on, 95% effective. Safety. So there were a few people in the Pfizer group that had Bell's palsy, which I spelled palsy wrong, but Bell's palsy is when all of a sudden your forehead stops being able to move and your face slopes and your eye droops and the nerve that is coming out here ceases to work. This is not a stroke. This is not a problem inside the brain. This is just an autoimmune issue that happens. Sometimes it's caused by herpes. Sometimes it's reaction to other viruses. But it's an autoimmune thing that we might expect to see after some vaccines. However, thus far, it seems like there was no difference in Bell's palsy incidence in the people who got the vaccine versus those who got the placebo. It's just something that happens. We see it. We see it a lot in the emergency room. So it is safe from the standpoint of Bell's palsy. CDC issued guidelines yesterday that said if you've had Bell's palsy in the past, it's still safe to get the vaccine. Guillain-Barre syndrome. So this is another immune issue. You know, sometimes when the immune system gets revved up, it attacks not just the virus or doesn't just educate the immune system, but it can also attack your nervous system. Really rare. There was an issue with Guillain-Barre syndrome and swine flu, but there has not been a single case of Guillain-Barre with this vaccine, either one, Pfizer or Moderna. Super cool. So we're good with that. AstraZeneca. First of all, the data right now is showing it's about 79% effective, so not as effective. It's much cheaper. It is stable. It's easy to transport. As early as today, the 30th of December, the UK was talking about approving the AstraZeneca vaccine. I personally would like to look at the data that goes to the FDA because the vaccine trial was stopped because at least 2 people had something called transverse myelitis, which is a hardcore in the spine autoimmune response, and it's really rare. So the fact that 2 people had it in the group who got the vaccine, I just want to know a little bit more about that. Nonetheless, Pfizer vaccines and the Moderna vaccine, super happy with the safety of those. Looking at questions about infertility, which have come up on various conspiracy websites. So on page 53, I think, of the Pfizer FDA submission, all it says is that they don't have any data yet about pregnant people. They didn't do it in pregnant people or people trying to get pregnant because they didn't know. So there is no indication that there's any issue with this infertility. And honestly, there's really no way the mechanism could work. An mRNA vaccine is giving the QR code for a cell to tell it how to make an antibody for the spike protein. Totally unrelated to fertility, to passing the placental barrier, anything like that. Doesn't make a lick of sense. So that's just somebody misreading what the science was that was presented. Okay, so another issue which was a concern for people was emergency use authorization versus a full FDA review. So first of all, one of the things the authors said was an issue was the concept. So emergency use authorizations have run the gamut from approving tests that normally it just takes 3 months to approve, and at the beginning of COVID, some of the laboratory tests who make tests all the time wanted to get it done in a month. Totally legit and reasonable. When it comes to vaccines, the full FDA review is going to want to have a lot of information, like can you transmit the vaccine, or can you transmit the virus, or are you just protected from getting sick? We don't know. There just wasn't time to figure that out. There's a lot of things like the fertility data. In a normal procedure with a full FDA review, we would have longer follow-up and we would know more. So it is true that there are a whole bunch of little questions, I'm going to call them little questions, that are not answered with an emergency use authorization submission. That said, the information that is submitted was as rigorously vetted from a safety and efficacy standpoint as any vaccine trial would be done. The numbers were there, the timeline was speeded up, but the data that they have looks like what vaccine submission data should look like. They collected it, it is legit. So we know a lot about the efficacy, and we know about one vaccine versus two. We know that only 52.4% of people are going to be immune at 4 weeks after the Pfizer vaccine. And then when they get the second one, it goes up to 94%, but 95. But we don't know if you didn't get the second one, we don't know how fastly it goes away. We don't know if it completely disappears. There's some things that we're not going to know because of this EUA procedure that we would know with the full FDA, but it's not relevant to efficacy or safety. Those are good. So one other thing that the authors do say, and it's a good idea, that it would be helpful if the entire process of what the difference is between full FDA and EUA were made clear in layperson's language, just like, here's the difference. And I think that that's true. That's part of why I'm doing this Facebook Live today, is to say in plain language, here's where there could be potential issues, here's where there aren't. So unsurprisingly, one of the issues with people supporting the vaccine was that they would believe a public health official more than a politician. So even though you see Marco Rubio rolling up his shirt and getting a vaccine and looking away, I noticed, even though you see that, that's not as convincing to the public as having a public health official or a doctor or someone else support the vaccine. That's gotten a little muddied because there's a lot of information now about the Trump administration's attempts to change the messaging from the CDC to not allow full science to come out, and that is damage that is done and is going to have to take a while. But all of the companies working on vaccines said that they would not submit the vaccines any earlier than they were ready to submit them, and they would not have any influence, and the FDA said it wouldn't have any influence from the administration. So I think right now the CDC is unfortunately a little tainted, but the FDA should not be. So there's that. Now, this was actually strikingly not mentioned in the article by Opal Salmon Marcuse et al. There was an Indiana representative, I believe, apologies if it's not Indiana, but who said, oh my goodness, they're shutting down businesses everywhere. What would the founding fathers think? There is this misperception that freedom is somehow limited by requiring public health. As a matter of fact, George Washington quarantined DC. George Washington wouldn't let people from other armies come because they were undergoing, or armies from different places come to his Washington Corps barracks because they were undergoing a smallpox epidemic. So quarantining, yes, Boston quarantined. Philadelphia in 1832 quarantined because they had a yellow fever outbreak. So there are lots and lots and lots of laws on the books and really good precedents showing that in the case of public health, you do not get the same access to constitutional freedoms that you do if you behaving in a certain way endangers others. So lots of good precedents for quarantines, for isolation, and for vaccination being required for public health. All right, so finally, this article talks about vaccine hesitancy. It says don't conflate the two because vaccine hesitancy has got a lot of popular culture stuff. But this is what I'd like to talk about before I start answering, boom, 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 your questions. Vaccine hesitancy and anti-vax are extremely related to needle fear, about 50% of it. And Dan Salmon himself actually wrote one of the first articles about vaccine hesitancy in 2005, and he noted that there was one vaccine that even the very hesitant parents let their kids have, which was polio. Only 12% of parents refused polio. The interesting thing was the parents who were in that group, polio was an oral vaccine. So there's still something about the needle that's an issue. So let's look at this herd immunity breakdown. This is how far we have to go to get little green people everywhere who are immune. There are ways to address vaccine hesitancy that are not just dealing with conspiracy theories. So of those who won't get the shot, we know that 2012 study by Target, the people that didn't get vaccinated, fear was accounting for about 30% of them. So that could buy us 19 million. Looking at getting a second vaccine, anxiety is something that decreases the uptake about 32%. So adding something that decreases fear 50%, we could conceivably gain 10 million people. The vasovagal fainting features. So Buzzy is the device that has vibration. It's a sympathetic stimulator. It blocks the fainting thing. And then pain, 74% of adults reported no pain with injections. If pain is the issue that's a barrier, that can add another 15 million. So that can get us into the territory of vaccination if it's a 60% herd immunity. If we start having more mutations and we really need to get to 80%, we got to do a little more. So the numbers in this new article from JAMA show that the acceptance of a vaccine is lower among women than men. One possible reason for this is women are more likely to vasovagal. They're more likely to get the lightheaded, nauseous feelings. It's related to both body weight and to blood pressure. So that could be a reason that could gain us a 10% willingness to get vaccinated. We also know that while overall in society, 28% of people are afraid of needles, it is extremely linearly related to what the vaccine schedule was when you were a kid. So if you're born before 1983, they are not afraid of needles. But if you were born after 1983, it's an increasing risk of fear up until being born in the year 2000, when 63% of people born in that year are afraid of needles. And it's just that they started getting 36 shots, and a lot of them while they're old enough. So this younger versus older, some of it could be COVID risk, but it certainly would make sense that some of that difference can be fear. So for example, here's a child life worker who got her vaccine using a ladybuzz. And what she says is, like with all the pokes I get, I used Buzzy, put it on for 60 seconds prior to the shot, move it up the arm, put it back on the side after a while, didn't feel a thing. The interesting thing that I have been writing to a few people in public health is that she also said that no one that she knows who's used Buzzy has had the soreness afterwards. And certainly we know that high frequency vibrations separates muscle fibers and makes it easier for potentially for the medicine to get in. There's data that the vibration we use decreases delayed onset muscle soreness. So it may be that it's not the ice with Buzzy, it's actually that having the vibration on for a little while before the vaccine, I don't know, tenderizes the arm, so it's not as sore when the medicine goes in. No clue on that. That'd be interesting to study, but it is an interesting observation. So why aren't we using Buzzy now? Much bigger lecture for another time, but I just think that healthcare workers don't respect fear. Needle fear and fainting haven't ever mattered for adult public health before. As I said, widespread needle fear is pretty recent. Healthcare workers kind of feel like you deserve it if you don't get a shot, because who would choose death over a little poke, and just don't realize that irrational fears are irrational. And then, of course, the thought that Buzzy is for kids, when in fact it works about 10% better for adults. All right, so what are the vaccine questions that we have gotten on our Buzzy Helps website? So one person asked, if I'm on immunocompromising medications, is it safe for me to get the vaccine? Yes, it is. If you're on Humira, if you're on Enbrel, if you're on something for arthritis, even glucocorticoids, there is no live virus in this vaccine. There's not even an inactivated portion of the virus. There are instructions that are genetically, like to 3D print an antibody to the spike protein that is only on the SARS-CoV-2 virus. So you're not getting anything that itself is going to infect you or be an issue with your immune system. What you are getting, and what makes some people feel sick afterwards, is that anytime your immune system revs up, you associate that feeling often with feeling sick, and sometimes it does make you feel sick, like the shingles shot. So that's not dangerous to you. That's just the toll that your immune system getting activated is taking. Doesn't damage you, makes you stronger, literally, but you don't need to worry about that. Okay, if someone around me gets the vaccine, will they shed and be contagious to me? No, same thing. There's no active virus here going on, so there's nothing to be worried about. Does it make someone around me less likely to be contagious? This is a good question. We don't know. So if somebody else gets vaccinated, they are very much 95% likely to not get sick. Are they an asymptomatic carrier risk? Don't know. That's the kind of thing that we're not finding with, because it's an EUA rather than a full FDA. Doesn't make you less, the sickness and not dying is what's important here, but that is something that we don't know. Another question that someone just put through was, why is Georgia lagging behind in administering vaccine? Yeah, I mean, it's not just Georgia, is it? We expected to have 20 million vaccines delivered by the end of this year, and there's a day, and we're at 2.1 million vaccines. Some of the things that are difficult is, usually with mass vaccinations, like when I'm at Children's Healthcare of Atlanta and they would give us flu vaccines, it's a big process to set everything up. Everybody's getting vaccinated over 2 days, and so everyone comes, and it's just like clockwork. Boom, 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 boom. The problem is with this, you're not getting a full hospital's worth. You've got people jockeying for positions. You've got to wait. It's not like, okay, everybody in the emergency department come through. Sometimes they would even come through the emergency department with a little trolley and a snack and give you your shot and a snack, and off you go, and you've got your flu vaccine. So in addition to the extreme cold issues with logistics, in addition to the issues with only a small number of people, a small number of vaccines being delivered, the other really big thing is that even making the decision of who is eligible and setting up a time for them requires a whole different level of logistics and planning. So once we're not in a situation where hospitals or nursing homes are limited, once we've actually got all of this, all of the vaccines delivered, and you can just say anybody come and show up, that's great. But there are certainly places where I have colleagues who were working the overnight shift when the sign-up list went up, and so they're on the front lines and they missed their opportunity to sign up. It didn't work. This has never been done before, so that's part of why. All right, is my neti pot good enough for irrigation? This is a question that was related to the COVID tested positive, now what? As some of you know, we are testing nasal irrigation for COVID positive patients age 55 and up, and seeing what happens with them, see whether or not it reduces the likelihood of them going to the emergency room or to being hospitalized. We have completed enrollment. We are still in the 28-day follow-up, and I can certainly tell you that from what we've seen so far, it doesn't seem to make a difference whether were you adding baking soda for alkalinization or betadine for virucidal, for killing the virus. Irrigation was what did it. So the irrigation we used was either a Navage system or a NeilMed sinus rinse, and we have not seen any difference between those two. They both seem to work. So I think that high-powered irrigation probably is better. Neti pot is slower, but I don't have data on that. All I can tell you is we know that the NeilMed and the Navage both seem to be equally good. Another question. Someone said, I tested positive. I am almost done with my Z-pak. I felt bad for 2 days and then started feeling better. When I get off my Z-pak, are the symptoms going to come back, or will I feel bad again, or will I have enough antibodies not to worry? Well, let's start with presumptions in this question. Azithromycin has not been shown to make a bit of difference in any of the COVID trials that have been done. Zip, bupkis, nada. We don't need to be encouraging antibiotic resistance by giving it. So doctors who are listening, I don't fault you if you were given it, but doctors who are listening, do not write for a Z-pak. There's not a shred of evidence that it helps. Second, so this is from Paul Malik et al. In Eastern Virginia Medical School. They published a really nice review of their protocol about a week ago. So, but looking at the clinical symptoms, so around day 5 is when people are starting to be symptomatic. They're contagious for 2 days before that. The viral replication and the symptoms go up and then go down, and then you start having your immune system. If it's going to attack your lungs and if it's going to cause a problem, that's when it happens. This is why we had early on people who would have chest x-rays that showed ground glass little areas of places where the lungs were being liquefied by COVID virus, but they didn't feel bad yet. So my answer to you is Z-pak really won't matter at all. The issue is going to be just what happens in the second phase of the illness, and that is unpredictable. Keep taking your vitamin D, your magnesium, your quercetin, and your zinc. Now, baby aspirin. So I have recommended baby aspirin. Someone asked me, do I really need baby aspirin? Do I have to go buy that, or is big aspirin okay? I actually would like you to go to the Buzzy Helps Facebook page in maybe later today, day or two. I don't know the answer to this yet. I'm not even 100% sure on baby aspirin. I can tell you that when my husband tested positive, we started nasal irrigation, quercetin, zinc, vitamin D, but magnesium, but he did not take baby aspirin. So I clearly don't believe in it enough to bother going and buying it myself. But I need to research this more. So I don't know is the answer on this one. All right, that is my presentation on what we do know about why people aren't taking aren't willing to get the vaccine, overriding hopefully some of the concerns about safety. Certainly efficacy looks good. One other question that came in was, which vaccine will I get when I get a chance? And are we likely to have the option to choose? I would bet that we will not have the option to choose. I think that it is going to be whatever shows up, and you get what you get and you don't pitch a fit. I wish it were different, but I will say that I would feel fine with either the Moderna or the Pfizer mRNA vaccine. I've got another one talking about the differences between that. Don't suffice it to say, I think that the traditional method of vaccines with adenovirus vaccine vectors versus the mRNA seems like the adeno is less effective. That's one of the AstraZeneca ones. But I mean, honestly, if I could get a nasal vaccine, which they're working on at University of Alabama and Birmingham, that to me probably is the one I think is going to be the most effective. But I think beggars can't be choosers. Let's see. Any other questions we got? Thank you, Ambassador Shapiro. All right. Well, this has been a double wide as far as Friends of Buzzy updates go, but I do appreciate everybody for tuning in. Please feel free to join us on buzzyhelps.com or no, Buzzy Helps Facebook page to ask any other questions, and we'll put them in next week's update. And until then, for God's sake, wear your masks, stay away from each other, do nasal irrigation if you get sick, and it's going to be fine.